acute abdomen. That is severe pain, persistent with sudden onset, and often accompanied with muscular spasm of the abdominal muscles and vomiting and fever. It can be because of peritonitis, so the peritoneum, the lining covering the abdominal cavity, has a problem, is inflamed. It can be appendicitis, so the appendix is inflamed. It can be because of diverticular disease, so little sacs to the outside of the colon, for example, having a problem. It can be peptic ulcer, and it requires urgent medical attention, and maybe a laparoscopy or laparotomy. And maybe when, and that is done in the hospital, and that is according to the Illustrated Medical Dictionary written by Sue Davidson, Penny Preston, and Francis Williams on the page 4. But this is no substitute for medical knowledge and also no medical advice. Hi and welcome. I'm trying to learn medicine today, acute abdomen, and after we've done that, we're gonna do squat training. And if you participate in the squat training, then it's better at your own risk. And we're talking about internal anatomy and stuff like that. And this is no medical advice, I'm just trying to understand what's it here. Acute abdomen, persistent, severe abdominal pain of sudden onset, usually associated with spasm of the abdominal muscles, vomiting and fever. Does the persistent mean it recurs always again, or does it mean as soon as it had its sudden onset, it is persistent? So it's basically, it can come suddenly and then it is persistent, or does it mean it is over years not, and from then on it is a persistent malady? What does it mean? It is a persistent severe abdominal pain of sudden onset, usually associated with spasm of the abdominal muscles, vomiting and fever. So spasms of the abdominal muscles, vomiting and fever. The most common cause of an acute abdomen is peritonitis. We looked at it up once. It was, I think I know, the peritoneum, that is the lining between which lines the abdominal cavity. Pericardium. Peritoneum, peritonitis, inflammation of the peritoneum. So the peritoneum, the two-layered membrane, it's two-layered, but it's more, in the other book was nothing about 2 layers. It's a two-layered membrane. It's a two-layered membrane that lines the abdominal cavity and covers and supports the abdominal organs. The peritoneum produces a lubricating fluid that allows the abdominal organs to glide smoothly over each other and protects the organs against infection. It also absorbs fluid and acts as a natural filtering system. It absorbs fluids and acts as a natural filtering system. The peritoneum may become inflamed as a complication of an abdominal disorder. See peritonitis. And that is inflammation of the peritoneum. We're not going to do that now. So it can be a common cause is peritonitis. So inflammation or infection. It is always a big question. Maybe it is both together. But it's not both together. Inflammation. So peritonitis, inflammation of a peritoneum, a two-layer around the abdominal cavity. A two-layered membrane that lines the abdominal cavity. And when we have other causes include appendicitis. We did it already, that is the appendix, that is a 10 centimeter long thing at the beginning, I think, of a colon. And that can be inflamed. And that is also a problem. And abdominal injury can also cause of acute abdomen, perforation of an internal organ due to disorders such as peptic ulcer or diverticular disease. What is diverticular disease? Doppler effect. A change change in the frequency with which sound waves from a given source reach an observer when the source is in rapid motion with respect to the observer. Now, what did we get here? Diverticular. Diverticular disease. Diverticular first. Diverticular, small sacs or pouches that protrude externally from the wall of a hollow organ. They are thought to be caused by pressure forcing the leaning of the organ, though areas of weakness in the wall. Is it the same as embolism in cardiology? The presence in the wall of the intestines is characteristic of diverticular disease. Diverticular disease. The presence of a small protruding sacs or pouches called diverticula in the wall of the intestines and the symptom or complications caused by them. The term diverticulosis signifies the presence of diverticula in the intestine. Diverticulitis is a complication produced by inflammation in one or more diverticula. Diverticulitis, inflammation of diverticula in the intestine, particularly in the colon. It is a form of diverticular disease and a complication of diverticulosis. Diverticula may perforate and abscesses may form in the tissue around the colon, leading to peritonitis. Other complications include intestinal bleeding, narrowing in the intestine, or a fistula. So, what did we have here? Diverticular disease. It is the presence of small protruding sacs or pouches called diverticula, and the symptoms or the complications caused by them. Diverticula itself is just a small sac, but already that is not normal. They protrude externally from the wall of a hollow organ. They are thought to be caused by pressure forcing the leaning of the organ through areas of weakness, so it is not intended to be so. Okay, diverticula, that is presence and the symptoms of it. So basically these are small sacs caused through pressure out of an organ, for example, the colon. Diverticular disease. And when acute abdominal pain commonly begins as a vague pain in the center, but then becomes localized. So vague pain in the center and then a localized. It's actually just. An acute abdomen requires urgent medical investigation that may involve a laparoscopy or laparotomy. Laparoscopy did we looked up. I didn't really understand it, but maybe we're going to go a bit more detail right now. And treatment depends on the underlying cause. Laparoscopy. Laparoscopy. Examination of the interior of the abdomen using a laparoscope, which is a type of endoscope. Laparoscopy is widely used in gynecology. Surgical procedures such as appendicectomy or cholecystectomy are now often performed laparoscopically. See minimal invasive surgery. So at the site of incision, there are actually two incision points. We're having a gynecological laparoscopy. And one is, so we're going to talk now a bit about things like that. One incision point is a little below the navel, and another one 10 centimeters lower than. And there's a thing at the top is the laparoscope. Then we're having the light, an illuminated area. That is now for the ovary. And what is done? Laparotomy, any operation in which the abdomen is opened either for diagnostic purpose or for surgical treatment. No, he's not written what this is for. We could look at gynecological. No, it's not. No entry. Minimal invasive surgery. Let's take a look. Surgery using a rigid endoscope passing into the body through a small incision. Further small openings are made for surgical instruments so that the operation can be performed without a large surgical incision. So it's basically, instead of making a big cut, just come in with a needle basically. Minimal invasive surgery may be used for many operations in the abdomen. See laparoscopy, there was not much in it. including appendicectomy, cholecystectomy, whatever, cholecystectomy, something. And knee repair and many gynecological procedures. Knee operations, see arthroscopy, are also often performed by minimal invasive surgery. Okay, basically instead of making a big cut and completely opening, just a little, just only in the instrument. Any acute abdomen requires urgent medical investigation. It may involve a laparoscopy or laparotomy. Are we able to make the presentation now? Acute abdomen, it is severe abdominal pain of sudden onset, persistent severe abdominal pain of sudden onset. Usually associated with spasm of the abdominal muscles, vomiting and fever. And it can be peritonitis, so inflammation of the lining covering the abdominal cavity. Can be appendicitis. The appendix is inflamed. It can be a peptic ulcer or diverticular disease, and with wars. But there are basically little bumps, sacs as we call them, sacs to the outside of the colon, for example, and begins vague in the center and then more localized where it is. And it requires urgent medical investigation. Maybe I'm going to say it, laparoscopy or laparotomy. Laparoscopy, laparotomy. I'm going to start the camera. Acute abdomen, that is persistent severe pain with sudden onset, often accompanied with muscular spasm of the abdominal muscles and vomiting and fever. And it can be because of a peptic ulcer, it can be because of appendicitis, so inflammation of the appendix, it can be because of diverticular disease, so with small sacs to the outside of the colon, for example, having a problem, or it can be, and I want to look for the most thing. It was peritonitis itself named. Okay. Acute abdomen. That is severe pain, persistent with sudden onset, and often accompanied with muscular spasm of the abdominal muscles and vomiting and fever. It can be because of peritonitis, so the peritoneum, the lining covering the abdominal cavity, has a problem, is inflamed. It can be appendicitis, so the appendix is inflamed. It can be because of diverticular disease, so little sacs to the outside of the colon, for example, having a problem. It can be peptic ulcer, and it requires urgent medical attention, and maybe a laparoscopy or laparotomy. And maybe that is done in the hospital, and that is according to the Illustrated Medical Dictionary, written by Sue Davidson, Penny Preston, and Francis Williams, on the page 4. But this is no substitute for medical knowledge and also no medical advice. One more look at the two words: laparoscopy, laparotomy. I'm going to write it in the subtitle, in the sticks. Where's the camera? And that was the medical part. If you were here for medicine, you can now repeat the next part of medicine, where we're going to talk on about medicine. If you stay here and participate in the squat training, that's really on this one leg up. Check the leg up. One leg to the side, the toes are pointing in front, essentially inner side of the leg. To the other side. And on side to side. And now to the squats, to the sides and 12. 1 and 3, 4, 5. And we're having the half. 7 and 8 and 9 and 10. And the last two, 11, and but we don't have much time. Stop it down and press against the top part of the leg. And on the other side. Half squat, middle. Middle. 3/4 squat, goes to knee, plus the knee. Press against the knee, go towards it. Press, go towards it. Press, go towards it. Press, go towards it. Full squat, arms to the sides, up to one side. Press against the leg. And up and then forward. So stretching. One heel onto the ground, pull the toes in. Left side pull in. Right pull in, middle, move from left to right. Arm up. Middle pull in, right pull in, left pull in, middle, left to right. Leg up. The other one. Take the leg here. Other one. Legs to the sides, in and down. Out, breathe, and then close the legs. And breathe. It was the Carsten squat training. I thank you very much, and until next time.